Hi, everyone. Thank you for joining us. My name is Tara Fournier. I am the Awakened Hygienist, and I have the pleasure of introducing all of you to Victoria DaCosta. I'm really excited to have her on here for a number of reasons. One, she's a fellow, dental hygiene sister, and she has been thinking, creating, and working outside of the box of our profession. And the way that I met Victoria was through social media. She had posted in one of our dental hygiene Facebook groups about thermography. Now, for me, I am familiar with thermography because about 8 years ago, I had a full body scan at my chiropractor's office. I had some things that I was questioning, and I got the answers with this thermography scan. And so when Victoria posted about doing thermography, I was like, how is this happening? I need to know more. And so I commented and said, I want to know more about this. She reached out through Facebook Messenger. We connected. We got onto a Zoom call and we talked for about, I think, 2.5 hours. I learned so much about how Victoria is using thermography in dentistry. And so I just had to have her on here and interview her to share all of this information with all of you. This is super important information as a diagnostic tool, but it's also really amazing information if you are looking outside of our box that we are kind of put into. So, Victoria, please introduce yourself. Tell us all about you and your path so far that's led you to where you are in thermography.
Sure. I'll introduce myself a little bit. um, my name Victoria DaCosta, and I practicing dental hygienist for 25 years, 30 years in dentistry, 5 of those years as a dental assistant before I became a dental hygienist. So my heart and love and passion really in the dental world started way back when I was passing tools to the dentist and asking questions about how come a tooth that has a filling on one tooth and the one next to touching it doesn't have a filling, and how come it doesn't have decay? And the dentist would say, I don't know, just hand me the instrument and fill the teeth and give me the mercury stuff to put in it. Well, that didn't sit well with me. I'm a very inquisitive person. And so I went to become a dental hygienist. And as I became a dental hygienist, I asked a lot of questions as well. But it wasn't until I was in a little bit of story how I got into this. What we now know as oral systemic links is I was working in a periodontal office, which you all know that when we work in those environments, we see the advanced cases that can't be treated in a general practitioner office, and they're referred. And one of my cases was a 30-year-old girl, and she was probably class 3 perio, 30 years old, class 3 on every single tooth. And I was a root planing on one of her quadrants, and the pocket depth was probably about 7 to 8 millimeters. So she was on her way to full dentures.
Right.
And she was in tears. I was in tears. And I came home so upset. And my then husband, who was a medical doctor from Europe, said, you really need to treat her systemically first to clear up her periodontal disease in her mouth before you clear up the disease at all. So I went back and on my journey and then back into my dental hygiene profession with that in mind, that everything I saw in the mouth was connected with the body. And it wasn't until I was injured myself with taking dental x-rays, I had to get out of the profession because I contracted cancer taking dental x-rays, which is another story for another time. I had to think out of the box. If I'm no longer able to practice dental hygiene, what am I going to do? And I love dental hygiene. I love working with patients. I don't want to work for a corporation selling toothpaste. I'm a dental hygienist. I went to work with patients. So on that trek, I hooked up with some really wonderful doctors in what we call natural medicine And they said, Victoria, you have all this information about oral systemic. Why don't you use it? And also, why don't you encumbrance assessing oral systemic with a device that is a digital infrared thermal imaging camera? And I said, what is that? And they said, there's no radiation. It's all temperature sensitive, but you'll be able to take a camera and put it on a person and see the oral systemic links. So that was my story. And that's how I got started, Tara. And I've been on it ever since. And you can't you can't take me off of it. I see the potential. I have the potential for our hygiene sisters in it. And it's a wonderful, wonderful journey. And it's safe. That's the best part about it. It's safe and it helps save lives, because we as dental hygienists, we are taught to do these pre-screenings, pre-medical screenings. We're taught to do these oral systemic screenings in school and out of school. And how many times do we drop those screening assessments just to stay on schedule, make sure we, quickly go over the health history, 5 minutes, no changes, get in the mouth, see the blood. What do we do? Lecture floss, lecture brush. What have you not been, and the patient's beat up? That's not the way to practice healthcare and healing. The person feels guilty. They're only there because they get the free so-called cleaning on their 6-month insurance, benefit, and they want to take advantage of it. So I really have been thinking out of the box all these years, how to help empower our patients to heal with our dental hygiene oral systemic link knowledge.
Yes, yes. That is exactly what I want us to be focused on. It's what I talk to my patients about, incorporating also me being a health coach, talking to patients about nutrition, oxidative stress. What are they doing to their body? What is their lifestyle? What their thoughts can even create for them. And so this is just amazing information you are giving us. Can you go into more detail about what thermography is exactly? So if a patient comes to you, what explain the process of what thermography is for those who are listening who don't know.
Absolutely. Thermography has evolved over the years. The best and the easiest and the quickest way I help people understand what thermography is. Have you ever watched a weather report?
Yes, that's a good point. Yes.
That's thermography.
Right.
Because the cameras or the sensitivity they use is temperature. So when you watch the weather report on the news and you see the heat wave coming in, that's because of a camera called a thermal imaging camera. Or a cold wave coming in. The thermal imaging cameras they use for weather reporting, and the air military uses them. The travel, I want to say international travel, all the airports use thermal imaging cameras because that way weather is such a big factor in travel. And actually, so is disease.
Yes.
Inflammation is heat. And
Exactly.
and it shows up red on the imaging camera when you're imaging a human, and when there's stagnation, then it will show up cold, and that's blue. And so really, weather report your body. That's get your thermal map of where the problems are. And most often than not, you'll understand it within minutes. You'll see the problem areas, or what we call hot spots.
So tell me how in dentistry you're using thermography as a diagnostic tool. So if you're working with a patient and you're using thermography, what kind of things can you detect?
Oh, what can I not detect? I have, with the neat thing about thermography, using a digital infrared thermal imaging camera that's sensitive to temperature, we see things, it's like glass house. I will see problem hotspot areas before the patient has pain, before the patient has a symptom, before the cell has had a chance to become a tumor, a cancerous tumor, or an infection that's blossomed into an abscess. I can locate and see, just mapping out with this camera, where the issues are versus dental x-ray. A dental x-ray, I'm going to have to wait how many years before the decay gets so bad that it starts showing on a radiation image. But with temperature, right away, just like when you have a slight fever, you feel it right away. But even so, I can detect leaking root canals that are leaking, and there's an infection that wasn't actually cleaned out when the tooth was treated, or a leaky feeling that's leaking, and the bacteria or the gum disease. I see it going down the lymphatics into the lymphatic mammary glands. I have seen root canal leaking teeth into breast tissue and growing areas and things you don't want growing in your breast tissue, or your sinuses leaking up into the sinuses, or better yet, the jawbone. And I've seen mapping out in the jawbone and the jaw. I've seen the jaw joint having issues, the TMJ, and I've also seen the from the chewing problems, they'll torque your neck. So if you're chewing on your teeth wrong and chewing it in a way that it puts pressure on a vertebrae, it could be so subtle. But I want to say that that subtlety can throw out your hips the way you walk.
Wow. Wow.
And the brain, I've seen it leak. I've seen patterns going up into the brain area, and that is scary because then you're looking stroke and Parkinson's. So I can pick up all these kind of what you call invasive health issues that people don't have a clue they have until it happens. Whereas with thermography imaging, I can see it 8 to 10 years before it's a major problem, and tie it into the teeth. Every single time I tie it into the teeth, because the teeth have blood flow and they have a temperature. How many times do people have cold water and it hurts their teeth, or the temperatures, or there's temperature sensitivity? That's because the tooth is alive. It's a live organ that has blood flow and nerve. So the thermal camera picks it up, the connections.
Yes. I mean, when you explain it like this, it makes me feel like every office should be working with a thermographer in order to really truly provide the necessary treatment for patients. We are helpers, and we want to help people heal, and that's why we're in this profession, because they come to us and we help them, and we teach them the right tools to get them into good oral health. But you can't the mouth is not a separate part of the body. And for so many years, our profession has looked at it that way, unfortunately. And so, this whole oral systemic link that has been going on for ages, but yet has just really recently become recognized,
Mhm.
this is something every office needs to be working with. And
Yes.
how amazing would it be for a hygienist to be able to offer this as a separate treatment, a separate protocol for
Very
patients,
exciting.
to really get the full understanding of what is going on in someone's mouth, or in their breast tissue, like you mentioned. I actually had a patient who, just real quick, had a broken tooth. She's like 90 something years old and had been putting off getting the tooth extracted. And it had been a couple years that she had put it off. And then when she came to me again, she was now explaining, when I asked her, "Have you had any changes in your medical history?" how her breast had basically swollen to double the size of her other size. And I'm looking at her, and I said to her, "This is on the same side."
Mhm.
And she said, "Oh my goodness, I never thought about that." And I said, "Something needs to be done about this tooth. We need to get this tooth out. It's infected." And it could be, I don't know, but it very well could be associated with what's
Yes.
going on in your breast tissue. So, you finding that, detecting that on the thermography scan, I mean, this is just amazing.
Mhm.
And how wonderful that we could provide more information to patients about their own body.
Well,
So,
I do have to say real quick, which as a dental hygienist, I was focused on the upper body, the head and, well, not even upper body, the head and neck.
right.
When I started working in this field and supplementing my income with this, I had to ask women to declothe.
Right.
And I mean, being a woman, they were fine, but still it was different because now I'm imaging an area that I'm used to imaging up here. Now I'm going down here. But I'll tell you, Tara, when I started seeing the connections in the drainage, you couldn't stop me after that. I said, we got it. This is a mission for our hygiene sisters,
Right.
because it's very much there.
I'm glad that you brought that up because people would probably want to know something like that about having to take their clothes off. So when
Yeah.
I had my full body scan, I had to undress. And
Yeah.
when the
Well,
thermographer, who was a woman, said to me, okay, go ahead and take your clothes off, I was like, do we need to turn the lights down a little bit? Like, it's really bright in here. But it is what needs to happen in order for the camera to be able, so it's just as if you're taking pictures of someone. I didn't feel anything going on, and like you said, there's no radiation exposure. It's
mhm.
literally a camera that is detecting temperatures. And so you're taking these pictures, and I remember getting into all of these funny poses,
Yes.
um,
The
kind of like
images.
when you go spray tanning, if you've ever done that, and so she took all of the pictures, and then it was sent to a doctor who was able to make diagnostic, or
No,
a diagnosis. So
the skin is a transmitter. And
yes,
so if you cover the skin, you cover, that's why you put clothes on to warm yourself, or you put
yeah.
jackets on or sweaters.
Mhm.
So yes.
Okay. All right. So how can a dental hygienist do this as an expanded function or as a sideline to her career? How does one do how do if someone says, "Wait, I want to know more information,"
Mhm.
what would this look like for a hygienist wanting to do this? Can you explain a little more about that?
Absolutely. And the first things first is getting your certification as a clinical medical thermographer.
Okay.
And but here's the thing. When I did get certified, I didn't see any oral systemic link training.
Interesting.
So I designed a new course that would include our oral systemic thermography training, because what they were looking at when they did breast thermography, they were just capturing images in the breast area and not the dental. And so you could see the inflammation in the breast, but once again, the Victoria, why is it there? I had to see why, and I realized it was coming from teeth, the
Mhm.
infection drainage. So you want to be able to work in an environment that you are capturing all the questions that a team of doctors will work together. And so I designed a website for patients to go and learn about what the reporting is. Right now, we're in the process of organizing our school online, but they
Wonderful.
can definitely contact me. And my contact's on my website, Tangram Integrative Health Solutions, but it's tangramihs.com. And under the tab WellPod Team, there's a contact, and my information is there, an email and a phone number, which is my direct cell. Be more than happy to guide you in helping get the phases started. If you wanted to start yesterday, no problem. We'll work. I actually can start working with you on the training and certification. I do have the qualifications, but I really am excited about mapping out a career option for our hygiene sisters in this field.
Yes. Because it seems like we all should be trained in this now,
There's no
as
question.
right.
There's no question. Mhm.
As we progress and as us hygienists want to have more responsibility and more autonomy, this couldn't be a better way to do that, really.
And really, we are the link, as I've seen it. We are the link to bridge the gap between the dental and the medical communities. I don't see it with the dentist. I don't see it with nurses or PAs.
Mhm.
Uh, Dental hygienists are the ones who have the training in oral systemic healthcare,
Mhm.
and all we need is a tool, and I invented the tool. So we'll use thermography, and we'll use the reporting system, and we'll have part of our week in imaging and part of our week in clinical, or what I call non-clinical days,
Mhm.
and work out of a medical office, which I have, or a chiropractor or a naturopath office or a wellness center. We're organizing our centers where you will be able to image. There is one dentist that started thermography in his own practice, and the hygienist, Tammy, became a certified medical thermographer. Inside, he paid for it, and she had her own room, and she was imaging part-time and working part-time in clinical. Now she's full-time clinical medical thermographer, and she's putting together her own business. And so that was exciting. And they had a 3-month waiting list.
Wow. Wow. That's amazing.
Mhm.
Okay, so you mentioned website. Can you spell that website out again? You said Tangram or
Yes, like getting a tan at the beach,
okay.
TAN, and then a gram of weight,
Okay.
GRAM.
Mhm.
I as in I, like HS.com.
Okay. So for those who are listening who are really interested in learning more information and connecting with Victoria, go to her website. And she said she's got her personal cell phone number listed right there on the
I do,
website.
right there on the website. Mhm.
Okay. All right.
So the best way I would say, excuse me, Tara,
Yes.
is the
Yes.
text message.
Okay. There you go.
Text message, and I will get back with you, and we'll set up a time and see what you want to do and how you
Okay.
want to become.
Yes.
And
Okay. And lastly, before we close,
yes.
we were talking briefly about,
Oh, yes.
yes. So go ahead and talk about that a little bit.
I was telling Tara before we started that there's a new movement in the dental hygiene world, and Jackie Sanders is heading what's called RDH evolution. And her goal is to be able, with our hygiene sister community, to have career options, be able to um, teach, not only teach, but enable. And we all, most of us are familiar with RDH Under One Roof.
Mhm.
She's part of that, and she's the chief editor for the magazine. And she is excited about RDH evolution and working together with me and some other dental hygienists on career options, because you always have the what if factor, and what's our backup plan if we cannot do clinical hygiene anymore because of an injury or who knows what.
Right.
But at least we are still working with patients. And so RDH Evolution is having their second meeting virtual in April. And all you have to do is Google it and you'll find it. And but that could be something. I'm not one of the speakers. It's too. I came in later in the recipe, but the goal is to think out of the box, like you said,
Yes.
Tara. And I really believe that's our future.
Yes.
Thinking out of the box.
Absolutely. Like I mentioned, we want to have more responsibility. We want to be able to, what I have found is we get burned out and we, reach this glass ceiling in our profession. And then what? And then what do we
So
do?
true. So
And
true.
so thinking outside of the box has to happen in order for us to be able to break through that glass ceiling. We can continue cleaning teeth, scraping, and telling people they need to floss more, but that isn't who we are as dental hygienists. However, that sometimes, as you mentioned, is the block of time that we get and can only do that. But how amazing would it be if we could
Wow.
think outside of the box and do, something that we also have passion for, more. Teaching is a huge passion of mine. Not teaching dental hygiene students, I'm not in a school to do that, but connecting with other fellow dental hygiene sisters and saying, hey, what more can we do to get out of this box that we have been put in? Because there are many of us who want outside of that box. Thermography is a brilliant path for us to be walking down, for our patients, for their health, for the practice that we're working in, and for us as a sideline profession, or into a full-time profession, basically.
Mhm.
It is something that we can do, still utilizing the information that we know about the mouth and creating that link between the oral and systemic health. That's hugely important. And not only is it hugely important we do that, patients are becoming more aware of it, because they're reading more, they're hearing more, they're evolving more, they're understanding that there's something more. And so, how wonderful it is that we can be there to say, yes, here, take my hand and let me show you. So, Victoria, is there any last things that you would like to say?
Yes, let's
Yes,
go. Let's get out there and save lives.
exactly. Yes, yes.
Help save lives. I mean, I can't tell you how many cases I've been able to help solve with the doctors because I did the reports and I have put the screening assessments in place, and they saw that the cause came from a tooth.
Wow. Yes.
And because of that tooth, they were able to save a life.
We,
And they would have never thought to look there
yes.
because the dentists aren't communicating with the medical doctors, and the medical doctors aren't talking with the dentist and about the patient case. But now we will be, and we are so important in this factor of bridging that gap. And so, yes, sister, let's go out there and save
Yes.
some lives,
Yes.
lots of lives.
We are the bridge. You're right.
We are the bridge.
All right. Well, thank you for all of you who are listening. And thank you, Victoria, for taking your time out to let me ask you
Absolutely.
these questions and to share with other hygienists. I wanted to get you out there, and I want the people who are following the Awakened Hygienist to understand there is more. Let's, oh, let's. Oh, let's wake up here, let's understand what more we can do for ourselves, for our patients, for helping the world, really.
It is.
So thank you. Thank you for your time.
Very welcome. Very
Thank
welcome.
you all for listening and taking the time to listen to Victoria share her path. And so I encourage you to go to that website to connect with her and see how you can bring thermography into your life, into the practice that you're working in, and into your patient's life. So thank you so much. And we'll see you next time. Bye bye.